I formally welcome Dr. Ihtisham.
Thank you very much, Sama. I hope everyone can hear me well. I really appreciate Beacon House School System for giving me this opportunity, and I welcome all the parents and students on behalf of Beacon House School System. So we're gonna talk about something what's currently going on, and it's nice to have questions at the end of the session. So let's start with our salient features of the discussion today. So I'm going to talk with respect to the health attributes and the challenges what we are facing right now in the COVID pandemic, and stress management, which is very important in the current time. Should we resume normal activity, which is very much pertaining to our today's activity, and understanding the new normal. And then we will have some questions at the end. I believe everybody must have come across this riddle, which was first, egg or the hen? And I always find it amusing. It has been used many times. So I was reading with respect to that, and in 2018, this riddle was finally sorted out. Being Muslim, we always believe that the hen came the first and the egg came later on, as God or Allah created everything as fair. But science proven that fact in 2018, and it was what we already knew as Muslim. So they proved it through the protein for which the eggshell is made of. So they finally come to this conclusion because this protein cannot come from elsewhere other than from the hen. So the hen came first. So I would like to start with the definition of extraordinary. And I believe this is something very important that we understand the concept, because naturally when there is something you face, any hurdles or difficulties in your life, you try to come up with a plan. And that what makes you extraordinary in an extraordinary situation. So it's an adjective beyond what is unusual, what is usual, ordinary, regular, or established. So that's what we're going to talk about today. So as it's pertaining to COVID-19, which was declared as a pandemic in March of 2019 by World Health Organization, as we all know, and the number of cases were noted all over the globe. So, and Pakistan was not an exception, and the number of cases rising up. But the important thing is to see the trend. And if you see the number compared to the world, we initially went higher up sometime in the mid of the June. And since then, the number of cases has gone down pretty much to the point that we are one of the countries where we feel we are very much in control. So this is the number from today morning, as a matter of fact. So there were just 196 new positive cases, and there are 1,444 cases which were recovered, and fatalities were 6 out of the total cases. It's a very promising number looking at the numbers from across the globe. Comparing to US or India, we are doing a much better job, and the credit goes to our governmental policies. And naturally, the community and the people has to play a bigger role in it. The facts regarding to COVID are that Pakistan has a much lower positivity rate of 1.8%. And as I already mentioned, so we are considered in a group of countries where we feel we are pretty much in control and the situation is not out of control. But we should realize few facts here that COVID-19 will stay for a while. And we should understand this fact, and we should take measures accordingly, because it has been almost 6 months or so in Pakistan when the first case was reported. And still there are cases coming up, but we are seeing a positive light, or the end of the tunnel, or the positive hope with what's going on. So we all know that schools are essential for child health and well-being. As we have noticed, the people are going to job, the bazaars has been open, markets are open, so businesses are starting up again. So now the next step is that the kids should start going to school and start learning, which is very important for their well-being, as we all know. So school open without precautions may have some problems. So this is something very important we should realize. So the school and the kids should take precautions, which I'm going to talk about. And as a matter of fact, I did review the video by the Beacon House School System, what they are doing right now in terms of preparation for or welcoming the kids to school. So that is very important that you all see that video and follow the protocols. And we need to figure out the way to open the school safely. And I'll say Beacon House has been doing a good job, because I haven't noticed a lot of videos from other schools in terms of SOPs or what are the policies and procedures they are following with respect to school opening, which we are expecting sometime soon in September. So as per the facts, so the children most of the time either have a mild disease or they stay asymptomatic. So just like any flu-like viral illness, not all the patients or kids will develop severe disease. So most of the time it's a mild disease. In the US, what they have noticed, because they have a much bigger population infected with the virus, so it infects kids much less than adults. So if you look at the numbers, out of the cases, 8 in 100,000 population of kids were infected, and 164 adults were infected. So you can see a much bigger population of adults was infected. And the one reason could be that the school started taking actions and they were closed pretty early on. The businesses stayed open for some time. So that could be another reason. So there may be some skew in the number, but this is an important finding which has been deducted from the data which we have available right now. So in terms of the risk factors for the severe disease, I believe all of us need to know people who have chronic lung condition, talking about asthma or some other lung condition like COPD, excuse me, or obesity or heart disease, they tend to have more severe disease. So these patients need to be more careful. And we all know that most of the time kids don't have these conditions, like talking about heart disease, diabetes, but I believe patients who are having these conditions need to be more careful because they tend to have severe COVID infection. But what we need to realize is how we can overcome the fear, because I think in present time in society, the fear is a bigger force playing around. So we need to understand that. So will we see with the opening of school, there will be increase in the number of pediatric cases? Will there be increased risk to teachers, parents, and other caregivers? Will there be a pediatric vaccine or any vaccine available soon? So these are all those questions which will become clear with time, because I'll say this is a very important time in everyone's life. I have never thought about myself being in a situation. I always read in medical books about epidemics and pandemics, but I am in one right now, which is very important, that I saw this time where we have to take measures which were really not ordinary. So with respect to the current evidence based on the data that we have available, so the kids can get ill with COVID-19, but as we see that the number is much less compared to adults, but they can have severe disease in case they are having some other medical condition. So the younger children tend to get a higher viral load, and what does that mean is that they may have when we do the testing, we do check the titers, which means the number of viruses are high, or the what we call colonization is high in the throat, but that doesn't necessarily mean high infectivity, but it just means the colonization, which what we know with the flu virus as well. But importantly, taking measures like social distancing, masking, ventilation, and a reduced class size are absolutely essential in the present time. So if we keep proper distancing between students, teacher and students, if we judiciously wear masks during the sessions, classrooms are airy, those will be something which will really help in reducing or actually not having anyone being infected with the virus. So there are certain markers of stress which I really want everyone to have understand, because with all this epidemic or pandemic going on, the most important factor which has been noticed is the stress of the situation. And I felt the same way as a doctor, because I was for some time I was off, and then I started opening my clinic and started seeing my patients with the gown and the mask and everything on. But yes, there was a stress, so we should realize that first, so we can take measures to handle it. So there was fear and worry about the health of the loved ones, and I believe adults and the kids all went through the same situation or thinking during this time. There may have been in some people changes in the sleep or the eating pattern, which is a sign of stress or anxiety, difficulty sleeping or concentrating, especially in kids or in patient population where they are already prone to stress, or they are not understanding the situation well. So they tend to be more worried about what's going on. And the worsening of the chronic health problem could be another worry with respect to COVID-19, or worsening of the mental health condition, which is very much understandable in the current time. So the evidence shows with all the data, especially from China, because initially it was noted in China and the initial reports and results came from there. So the 35% of the Chinese who questioned reported psychological issues or stresses with respect to the situation going on. And on top of it, when we quarantine these patients, it brings out or worsen the pre-existing psychiatric condition. So we need to understand and keep that social support. I'm going to come to the points that how we can handle this kind of situation, but we need to understand the people who are at risk of overreacting to current situation. And I have already mentioned some of them, but I'll go through the rest. So people who are at high risk for COVID-19, as already mentioned, the people who are old, having chronic medical conditions, the caregivers who are already under stress, and then they can overreact to what's going on, frontline workers, which by that I mean doctors or our police officers. So we really need to provide them that support, or show them that we are with them in this situation. And there are ways to do that. Essential workers, food find, I particularly put that on the slide, because even this COVID time, I have seen them walking around delivering food. So they were really exposed to virus or to this situation. So they must have been under stress that they have to do their job and earn during this time, beside that there is such a high situation. And we already talked about the people with mental health conditions, people who are jobless or who lost their jobs due to COVID, people with disabilities and who are socially isolated tend to react or overreact to any stressful situation. Racial and ethnic minorities, people living in group settings, like in the current prime minister started Panaga, where the people are living in as a group home, and they could be under stress because of the situation, because they have to share the space with many other people. But how to stay calm is the key. So follow as much normal routine as possible. This is, I understand, easy to say, but with the current situation where you have to stay at home and you're not working, maybe you may have lost your job or things are stopped. We need to understand that we need to do things to keep ourselves busy. And I am happy to hear from the parents what they did during this time, and I'm happy to let them know my personal experience. But we have to limit time engaging with news, media, and screens, because with that, there was more heightened anxiety. We all know that part. Try to be physically active. If you're not able to go outside to jog or exercise, you can have a treadmill at home. So there are ways to do things around. Healthy diet and enough sleep. I think that's what I liked during this time. I had time where I was not going to job, and I was able to sleep long hours, which was really nice to me. And I'll say everybody may have that time, but now is the time to get back to the routine. So focus on what you can control. So we all focus on what we can't control, but important thing is that we try to focus on what we can control, and that will give you satisfaction and some calmness. And maintain social relationships. It was naturally hard where you are not able to go out, meet your relatives, but you can connect with them through media, through phone, through cell phone. and you can kind of keep connection with them and have the updates from them. And in this way, you will feel more connected, stay optimistic, and spread positivity. Sorry for the, okay. So now the question with respect to how to manage school opening, because this is something very important. A lot of discussion has been going on. And even when I was preparing this presentation, I looked through my colleagues, what they were doing in the US. And there were a lot of suggestions. And I thought I should share those suggestions. And if something can be applied, would be helpful. So they were planning to do hybrid learning, which we are doing in some way. Most of the schools were online and teaching was going on, which is actually very nice on behalf of the school that they continue teaching their students. But what we can do as schools are opening, that we can have a limited number of students coming in, or making it a more hybrid model where there is online and in-school learning. So the students are not spending whole day in school like the usual in the past. And we need to understand that it is temporary. Monitor hallways for crowd, which is very important, especially talking about students having chit-chat in the hallway. So that shouldn't be allowed in the current time. Middle and high school students need less supervision, which is important, so they can do online learning way more easier compared to the elementary school. So that is an important fact which can be considered when we plan on our hybrid learning model. And there was one suggestion which is very interesting: the old school system where the people like to sit under the tree and they like to have the outdoor schools. So this is something very important because, as we discussed, the ventilation, open airy spaces can reduce the risk of transmitting the infection. So some outdoor distance maintained activities or learning could be something very helpful. Sedentary habits need to be addressed, as we all have been sedentary in this time. So that, especially on behalf of the kids and students, need to be addressed. And more importantly, the SOPs need to be strictly followed. And as I already mentioned, the Beacon School System already shared the details, and I really like that. And actually, some of them we are following in our hospital as well. So, and flu vaccine, we are not right now sure when that will be available, but once that will be available, hopefully we will be in much better control of our COVID situation. But it's a high time, and I'm not sure, and nobody is sure when flu vaccine will be available. So there are some national guidelines to follow, and I believe in people in the US, they tend to follow what's being offered by the government, how things are changing, what's their trend. And I have seen some of the people in Pakistan doing the same, which is very nice because government is keeping an eye, and I'll say they have done a nice job in terms of managing the situation way better than many other countries. So we need to continue following them, especially the Ministry of Health guidelines, Ministry of Education, and more importantly, National Command and Operations Center, and they have done a nice job so far. So looking at their national guidelines, what the school opening policy they have announced is from top to bottom approach, which actually meant that they're going to open the universities first, and then college, and then high school, and then junior school, and like that. And actually, they have their own reasons. They must have looked into that. But I think this is very important that we keep an eye on the trend. And we should avoid mass gatherings in the meantime, like talking about in masjid and other places, in schools. We should avoid mass gatherings, but we should continue to follow the SOPs. Government has started a TV education series, which is very nice, and it was actually reiterated in US Muslim community as well, where they were talking about having some educational channel. But it's good that our government has already took actions, and they are already delivering some education or continuing to give that education to our kids who are at home. Weekly assignments was another part which was discussed, and by that it means that students may not need to come in every day to submit their assignments, which has been given to them, but they can do it on after some interval. So there is no crowding. So that's the whole point of spacing it out. Contact sports, especially talking about football, could be something which is more closely played, is probably not recommended, but talking about table tennis, badminton, cricket, where the people tend to stay apart, the kids should be able to play, so they should continue to have some physical activity in this time. This is something very important, which I would like the parents and teachers, everyone to understand, because with all the stress of the situation, with all the apprehensions in terms of school opening and what's going to happen next, what we have to have is inner peace. And what does that mean is that we need to keep our spiritual bonding. So we should trust, like the usual, that everything is from the will of Allah, and we should face it, and we should be prepared better for that. And there is always a silver lining at the end. So I'll say we should continue with our physical well-being, psychological health, and spiritual bonding to continue the inner peace and calmness. And once the adults are calm and peaceful, I believe the kids gonna feel more comfortable and they will follow the advice of their elders. Now I'll let you know my approach to this situation. And I believe everybody has their own approach. As I said, I would like to hear from the parents what they did during this time. So my approach is that I have to come up with some plan for my kids' education, and that is more important than anything else. So during the time when nobody was going out, we tried to do some online education. We tried to do some home learning, book reading, some other activities, even playing table tennis in a room. So we tried to do a lot of activities during this time. So we didn't waste it that time, actually. More importantly, we need to understand the kids' concern with the current time. So what they were thinking when school was closed, what they are thinking when the school gonna open. So what's going on their mind is important to know, so we can address it in time. And we should try to address their questions pretty quickly. Why? Because they tend to forget what was going on, and we get to the next part. So we should address it as quickly as possible so we can reduce the fear. And as we just said, that more we will be calm and in control of the situation, more they will be comfortable getting back to school. We should spend time with kids more at home, and also as well as during the playtime, so we can understand them better. Because many times kids won't ask you a question. It's not you're gonna make them sit and, okay, ask me a question, and they will ask you a question. It never happens to me ever. So the best way is that you are playing with them and they all of a sudden come up with something on their mind and they will ask you, which is the usual way kids ask their question. But those times are very important. And as I already mentioned with respect to reading and writing habits, this was a good time that we can get them on track of something which they haven't done in the past, or they have done to some extent, but we can refine that habit during this time. And we should ask them to be more vocal about their queries. And anyone who come across any question, they should be more vocal, talking to their psychiatrist or some of the doctor they know. So those queries, questions can be addressed, and the adult feels more comfortable. So the kids will feel more comfortable. I think this time was a best bonding time. I never had this much of vacation in my life, I'll say. So it was really good for me to kind of bond with my kids, and I got really close to them. But I should get them ready for the next step, because this situation, we have to get them ready to get back to the new normal. We should set an example for them. Like, I'm going to my job, doing my clinic. It's not a full clinic like I used to do before COVID, but I talk to them that the way I am doing it and how I wear mask all the time, and they should be doing the same. So if I'll set an example for them, they will most probably follow that. So the summary from our today's talk is that there should be innovation in teaching and learning practices. We should manage kids' time at school and at home. Outdoors are safe under supervision, and supervised schooling and activities are safe. Remember, this situation is temporary. Okay. So this is my last slide. So I just want to give you a little idea of the beauty of the nature in the picture on the right. It was taken in Islamabad. There's a sunrise coming up, and the second photograph is for my 3 older ones, and they are so happy spending their time, as you can see from their faces. And this is our recent trip to Kevra salt mines. And you can see we were wearing masks, not all of them, but we tried to. But remember, despite the fact it's not really an open space, but it's not crowded. So this is something we need to be careful about. I'll lastly say that we should keep balance between our professional, social, and religious attributes, and that will make us more calm and peaceful, and that will trickle down to our next generation of students and kids. Thank you very much. I'm happy to take any questions.
All right, we're waiting for the audience to ask some questions. If not, then I'll just ask on their behalf. I just want you to, Doctor, kindly rephrase that. How can we be more vocal about our kids' queries regarding the pandemic?
Sure. So I believe education is the key. Even my daughter, she did a presentation on COVID-19 for her school. So if we will educate them, they will understand the situation. Naturally, they are young. They don't understand it fully. So we have to practice few things in front of them, like wearing the mask and how we keep the distance and washing hands all the time. So what we need to do, what we need to do is that we need to have some time, like the playtime I mentioned, where they can ask those questions. And those are actually small questions. So, and we should let them know what are the facts. As I started my presentation and gave you the numbers, and the numbers are getting better. There are very few people who are getting infected now. So if we will talk to them this way, they will understand it better, and they will not have conflicting messages. So we should let them know, see, in our country, there is only 1.8% of the population is getting infected, which is very nice compared to other countries where it's like 5 to 10%. So it's a much bigger population being infected. So that is one thing. Second thing is that our people are, even they are infected, not all of them requiring high level of care like ventilation or ICU. So not actually, we are doing a much better job with respect to that.
All right, thank you. So you think that this is the new normal and this is what we are going to tell our children?
Yes, and they should understand this new normal because if they will not, they tend not to follow the guidelines or SOPs. And that's what we want them to do, because we want them to understand that, see, this is what the situation is. This is what they have to do to be safe. It's just like when you're crossing a road, what you tell them that follow the signal, see right and left, and then you're going to cross the road. So it's a similar way we're going to tell them that this is the situation. You have to wear the mask, you have to wash your hands regularly, and you have to keep the distance. So it's kind of similar phenomena.
All right. Doctor, I've got another question. How can we stay determined against this situation for a long time? As you said, it's in human nature that we fade away quickly. So what do you think about it?
So what I'll say, that was kind of the tagline at the bottom, is that the situation is temporary. So my take on that is that nothing is permanent. No hardship is permanent. Like the surah in the start, if somebody was reading the translation, so after the hardship there is ease. So yes, there is a hardship right now, but there will be an ease. And I think we have learned a lot. जो कि मैं स्ट्रेस करूंगा ये वाली बात कि इस सिचुएशन में एज पेरेंट, एज फादर, एज अ डॉक्टर, हम सब ने बहुत लर्न किया, जो कि एक बड़ी अच्छी बात थी. So there was not everything was bad. There was a lot of good things. As I said, that the kids bonding time. So similarly, I'll say that there are pros and cons to every situation.
All right. We've got another question. How frequent do you suggest the face mask should be replaced?
That's a very nice question. Again, depending on the nature of the face mask, because I read some articles as well. So country to country, guideline was varying. So UK was following some of the guidelines, Pakistan was following some of the guidelines. Important thing is that we wear some masks. आपने देखा होगा कुछ लोग सिर्फ कपड़े का मास्क पहन रहे हैं, कुछ सादा disposable mask पहन रहे हैं, ठीक है? So I'll say wear some kind of a mask, and even in the US, people were wearing those cloth mask for like long period of time on a daily basis, which was very interesting. Lekin, I'll say keep it clean, keep it washed, okay, keep the distance and wash your hands. क्योंकि वो चीजें ज़्यादा easy हैं. If you are not in a situation like as a doctor, I'm in clinic, and in clinic there could be any patient who will be infected. So I need to be more careful. So I usually wear a mask, which is a N95. So I use it for like 5 days, and next week I use a new mask. So that's what I do. And that was the UK guideline with respect to that. अगर वो जो disposable सादा वाला mask है, I'll say you can use that, but if it gets dirty, just get a new one. क्योंकि वो replace नहीं हो सकते. If you're using a cloth one, then you can use it for a day or two, wash it, and then use it for a day and two.
Okay. Another question, same related to the mask. What do you suggest that wearing masks for longer time, is it safe for lungs?
That is another very important question. I was reading an article as well that wearing a mask makes you oxygen deficient, which is very interesting, which is really could be a good theory as well. But I wear it almost straight 4, 5, 6 hours. It's cumbersome wearing the mask all the time because you sometimes get a little bruise on your nose. So I'll say, especially when you're in a situation where you have to be close to people, tend to wear the mask. And when you're in a place where there are not people around and you are on safe distance, you can kind of slide it down for some time. It's not that you do see some people just keeping it on the chin all the time.
Yeah, right,
There's
right.
no use for that. So it depends on the situation you are in. But I think understanding the situation is better. So the kids need education to understand what they need to do in certain particular situation. And as adults, we need to endorse that situation.
All right, I've got a question that, God forbid, if school encounters by a few COVID cases within a short span, what would be the next step for the school? Like, what could be admin take another step?
Uh, and actually, as I said, I was reading with respect to what's going on in US as well, and this was a question over there as well. That what should be so important thing is that it's not going to be the kid only who's getting infected. So
Right.
if they're getting, question is if they're getting that infection from school or from their adults at home, because like as a parent, I'm going to hospital every day. So if I'm not taking care, I may be the one bringing the infection home. Okay.
Right.
So we need to realize that part. So it won't be the kid only having the infection. So there may be some other family members. So important thing is that we do the what we call the contact tracing and continuous surveillance, because by that we will be able to see if the number of cases rise after opening of school or not. Again, if somebody have noticed the situation on the Eid al-Fitr, when they opened the markets and there was a big crowd of people out there, and immediately after that there was a surge in the number of cases. So and that's why I really like the video by the Beacon House school system where they have shown what they are doing. So that's why following the SOPs is very important. And there were some studies in the US again with respect to people who were outdoor camping. So and what they have noticed were some important findings that if there are a large number of people in a same camp, it's not a well ventilated camp, the chances of a transmission of infection were high. So that's why I mentioned even in my slide as well that ventilation of the classrooms, less number of students compared to what our usual normal is very important. So keeping the distance and the wearing the mask is an add-on. So it's like you are taking extra steps, making yourself safe. So I think with all this, I'm not expecting that the number going to rise, but following the trend and continuous surveillance of the families. And I think we should be more vocal with respect to if in case somebody noticed symptoms and they find out that their kid is positive or any other family member is positive, they should let the school know, they should let the government know. So the government can plan accordingly. So it's not about one school, actually. So, and all the schools can plan accordingly. So it's like continuous surveillance because it's a very uncertain time for everyone.
True. All right, doctor, we've got another question from a parent. Is it necessary that every country will face a second or third wave of COVID-19?
Right. So actually, we all know that New Zealand had a second wave, and they took measures right away. In the U.S., when they went from phase two to phase three, they started having this increased surge in the cases. So again, what I'm talking is with respect to markets, because if the businesses are closed, there's a big hit on the finances of the common people. So that's why they noticed the increased surge in the number of cases. In terms of the school, it has been a mix. But again, as I said, even in the U.S., schools are taking measures. They are some of the counties and states, they are opening. Some of the states, they are kind of holding on, and they're going to see the trend how things will go. So and that's why our government planned top to bottom, with my understanding, because they felt the people who are in universities, they're going to follow the SOPs more nicely compared to really young kids. So I think that will give us some idea that how things going to go from 2 to 4 weeks later on.
Sure. There's one question. What guidelines do you suggest for parents, especially when they drop or pick their children from school?
Sure. So most of the, based on the system, most of the parents stay in car, or they should stay in car and wait for their kid to walk over to them. Because if they will crowd to pick their kid, like if they all of them start gathering on the gate, it will be really harder. I think on the side of the school, they can plan some time between different classes to get off from the class. So that will help reduce the number of people gathering in one time. So I think that would be helpful to handle this situation.
Thank you, doctor. There's another question that what if a child is asthmatic or has got weather allergies? What precautions do you suggest?
Sure. So more importantly, that they need to follow the SOPs, like wearing the mask, be careful, don't get in touch with someone or close to someone who has mild flu or flu-like symptoms or fever. In case they notice any similar symptoms, they should let their parents know in time. So that is more important because, as a matter of fact, asthmatic kids or adults, they tend to have infection or worsening of asthma during the year with the change of the weather. Like the winter season is coming, so I'm expecting there's going to be some rise in asthma cases. So
Yeah.
and flu virus infection as well. So I think they just need to inform the parents in time. Testing can be done, and we can plan accordingly. Because even with respect to the asthma patient getting worse or severe symptoms is debatable right now. There was a study where they noticed no change in asthma patients in terms of the severity compared to regular population. So as I said, as the data is kind of getting together, there are some clear guidelines, and then there are some mixed guidelines as well at the same time. But I don't want the parents to get confused with respect to the asthma part. So it's a mix right now that does they really get more sick with COVID or not? But more important thing is that they follow the guidelines. They be careful in terms of any minor infection they get. If they do, they should stay at home. Let the school or the school teacher know about that.
Okay. And do you think that asthmatic children should wear some special marks?
No, I'll say they can continue wearing the regular mask because there has been a lot of rumors. Just to let you know, uh, जब से ये शुरू हुआ कि जी ये जो कपड़े वाला मास्क है ये इतना अच्छा नहीं है, ये जो डिस्पोजेबल है ये सिर्फ एक दिन यूज होना चाहिए, और या जो हमारा N95 है वो 5 दिन से ज़्यादा यूज नहीं होना चाहिए. But it all depends on the resources. And just to let you know, even US, which is an affluent country, very quickly they run out of resources. So we just have to be more cautious rather than because by this we will be draining our resources if we will start using a mask on a daily basis. And that's why very quickly they come up with the plan that you can continue wearing this mask for a couple of days and it's safe.
Okay, so do you think that N95 in such weather conditions, is it favorable for wearing for straight hours, even for students?
So I wore that N95 almost every day. So,
Okay.
but you can't keep it all the time on your face. It's really hard. The seal is really tight. So, and I can clearly tell you that it's hard to wear for long hours. So it won't be very feasible for the kids. And I'll say even in US, you must have seen a lot of people wearing those cloth masks. So that can be used, but it should be kept clean. That
Yes.
would be more important. And I think social distancing, if you're already keeping a proper distance from your colleague, you shouldn't be worried about the mask that much, as my understanding. And this virus doesn't stay on surface for a long period of time. It doesn't survive for a long period of time. So we shouldn't be worried about the staying on the surface for a long period of time thing. But importantly, we should follow the distance. We should do hand washing because if we are eating, from the same surface and we're shaking hand with a colleague, I think that would be a direct reason for getting the infection rather than the air-related transmission.
Right. There's one question regarding physical activities. That what sport do you think are favorable in these conditions?
So I already mentioned during this time, luckily I got a table tennis at home. We just straightened it out. We played long hours. So table tennis, there are like two people, maximum four people. They play on one table. So that is nicer that you keep the distance. Badminton is nice. That can be done. So, but talking about the contact sports, especially where you get really close to other people, there are chances of transmission. Again, I know cricket is opening up again, so the cricketers are playing. The other thing could be doing the COVID testing for I believe the school staff would be helpful because that is one person getting in touch with a lot of students. So if some teacher has symptoms, they should get checked, and they should be just like his following the SOPs. That will be more important, in my opinion.
All right, thank you. We've got a question for seasonal allergies, but I think, Doctor, you've already discussed along with the asthma. Okay, so if anyone has got any questions, kindly write it on the chat box so that we can ask our doctor, our expert over here. All right, we've got a question.
So what's the
Okay,
question?
your pick of the tips for parents, you suggested that to have a stronger mindset than ever before. So, would you elaborate
Right.
it, please?
Sure. So that's why I had that slide where I had the three things: the spiritual bonding, physical well-being, and psychological health. So spiritual bonding is like we all believe and trust in God. So you keep that connection and you trust that everything comes from God with a reason. So we have ways to overcome that because it becomes really hard if you are not strong in any of these components. If you are not physically strong, you tend to feel that you may get infection and it will be a severe infection. So we should keep ourselves physically active to keep healthy. At the same time, when you stay physically active, you tend to be psychologically generating that positive energy. So that is very important that you keep all these components in mind. And I think it was a good time to kind of have that combination stronger because what's happened in my life, if I'm busy with my patients, sometimes I come late. I don't have enough time to spend with my kids. I'm trained late. So kind of shortening everything after my job. So one chunk, well, one big chunk is my professional part, and small chunks are social and the spiritual or the religious part. So I think it was a good time where we were having more time to be religious and giving more time to our family and to ourselves than the professional part. But I think we should realize that we have to keep the balance. So understanding the balance makes you stronger.
Okay, a question. Do you think that the second wave of COVID-19 would come in Pakistan?
Sure, it can. The important thing is that we should be mentally ready for everything. And I think that's the most important part, that we shouldn't be hiding the facts or the trend, and we are not in a false hope situation that, oh, nothing can go wrong or differently. Yes, second wave of COVID can come. That's why I said if somebody noticed that someone at home is getting in some symptoms, they should get them checked and report, because hiding will actually worsen the situation. Like we initially noticed during the first wave, people came from international trips and they didn't get checked, or they skipped through the process and they went back home, and then they infected their own family members with that infection. So important thing is that we don't hide the information, and we should share it in a way that we can channelize that information to make more policies and SOPs accordingly.
All right. I think I'll go for my question now. That how could the parents overcome the fear of sending their children to school? Because still there are some parents who think that they won't be sending their children to school for a month, and later when situation will be better, they would send. So what do you suggest?
I think just like any other parent, I will be having the same thought. So, what I will say that we should see what kind of measures or action school is taking. Okay, that will help to calm the parents and to myself as well. Similarly, like what has been going on and what we have noticed in the society, like the markets are open way earlier than the school, but we haven't seen, like even right now the markets or bazaar are open. So but do we see a big number of cases coming up? No, we don't. So that means that it has to be only when we are in really in a small space where there are infected people and they can transmit the infection. Excuse me. So that is more important. So I think there was initially a slogan that we shouldn't fear, we should be more ready to face it. So I think with standard operating procedures, we should be more ready to face it rather than be fearful of the situation. Because if one thing we should realize, this infection uh, is milder, just like the any other viral infection. Yes, it was not like a regular flu, but if you remember, there were flu epidemics in 13th century and 14th century, and at that time, millions of people die because of the flu epidemics. But now, does that happen? Everyone once in a while get a flu infection, but is it that severe? No. So we all know the virus tend to mutate, and it may not be that severe or, I'll say, dangerous. But we should be mentally ready, and the parents should be ready, kids should be ready, and we shouldn't waste the time of the kids. And with the idea that the school gonna take proper actions, and the government is making sure that the schools are taking actions before they're gonna get into school. And if I'm going to clinic every day, thank goodness everything is going smooth. I wear the mask, I wear the gown when I see my patients, and it's been going on since May. So it's been more than 3 months. So with my personal experience, I'll say with bazaars open, hospitals open, and the number of cases are not rising, I think the action regarding schools will go well. But again, as I said, we should be mentally ready for any kind of thing, and that will be more important.
All right, thank you. I've got another question. Do you think in the event of confirmed case at school, what isolation protocols are needed?
So the government initially promoted that the patient should be quarantined in the hospital, and very quickly we ran out of the space in the hospital. So then they started doing quarantine at home. So I think for kids, especially, naturally they cannot stay in the hospital. It's very hard for them to be in a hospital situation. So I think it would be better if they will, in case there is some kid who's positive, and the parents take action, keep kids at home, quarantine, and make sure that no other family member get infected. And more importantly, they let the school know so the contact tracing can be done.
All right,
I
I've
just
got a last question, and
sure.
last question, doctor. I know you must be busy, and it's already 5 now. Just the last question. How often do you recommend students to sanitize?
Okay. So, in my opinion, what I do for every time I see a patient, I wash my hands. So I'll say every time they shake hands with someone, every time they go for a meal, or they are going to eat something or going to drink something, before that they should wash their hands. So that should be, I think it should be a habit that we should wash our hands before eating something. So during this time, it should be very important that before they eat something, if they are in a situation like if they are in one class and going to another class, and once they get to the next class, they should wash their hands again. So that would be like, more you do is better. But again, it's not that you can keep washing your hand all day, which is not possible. So it would be nice that before eating, they should wash their hands.
Thank you. I'm really obliged and I'm really grateful. Thank you for giving your time out of your busy schedule. And I would like to thank all the parent body for joining us in for this informative session, and especially Dr. Hitasham. Really grateful to you and for presenting this session with us today.
Pleasure.